Thursday, November 12th, 2020, and calling to order emergency meeting of the Boulder County Board of Health. Board members, please introduce yourself. I'm Greg Thomas, Board President.
Jorge de Santiago.
Morgan McMillan.
Brooke Harrison.
Morgan and Brooke, and Landry. Landry Fagan is on the call. So we have all 5 board members present. Jeff, if you want to take the honors for staff.
Yep. My name is Jeff Stayak. I'm the Director of Boulder County Public Health. Also for staff on the phone, we have Nadine Bridges, we have Chris Campbell, we have Sheila Davis, Tammy Golden, Chana Gassetis, we have Megan Hatton, we have Kate Haywood with the County Attorney's Office, we have Kelly Hinch, we have Joe Malinowski, we have Rita Mangan, and we have Dr. Chris Urbina. If I've missed any staff, please let me know. I think we're good.
Okay, and we have a quorum. So this emergency meeting of the Boulder County Board of Health is now called to order. Notice of this meeting was posted on the Board of Health website as required by law and included the teleconference phone number and conference ID. Members of the public could participate in the meeting. Due to the current COVID-19 pandemic and the need for social distancing and compliance with the current public health order, this meeting is being held telephonically as authorized by the Boulder County Board of Health bylaws. Take it away, Jeff.
All right, thank you. Thanks, board members, and again, thank you for your flexibility. I know that we didn't have a lot of time on this one, so I appreciate you making time to make sure you're here. We will not go over a whole data set of slides because I did that on Monday. I will show you just one slide about our incidence rate and how it's changed. But the purpose of the meeting is, as you know, as I had mentioned, when we have a indicator, one of the 3 indicators at the state that move outside the current level that we have been categorized as, which is we are currently categorized as orange, but we do have our incidence rate indicator is well outside of that at this point and is at the stay-at-home level. We are required to do a follow-up with the Colorado Department of Public Health and Environment and present to them a mitigation plan that talks about how we're going to try to assure that we don't move to that level and that we keep our numbers down. So what we'll be presenting to you today is a proposed order that includes 4 basic components. The 3 of those are order components and 1 is a strong recommendation. The order components are indoor dining, indoor events, and no spectators at sporting events, and then a very strong recommendation for folks to work from home to the maximum extent. I'm going to have Kate in a minute go over the order with you, and then open it up for questions to see what kind of questions you have. But I do want to show you one slide that demonstrates the challenge that we have right now in front of us as we're moving forward. Hold on one second. When I presented to you the other evening, our incidence rate was at 437.1. So on Monday evening when I presented, that's what that incidence rate was. What you can see here is just in those few days, our incidence rate has jumped to 556.9. You can also see on this map that the majority of Colorado is now in red, and this continues to change on a daily basis, and it continues to change at a very fast pace. The second thing that I have on the agenda for you is to approve a letter to the governor's office, and the letter to the governor's office is to ask the governor to act. And because when you look at the numbers of each of these counties and the incidence rates, and you look at the map, we know that individual actions by one county is not going to make a huge difference. So those are the 2 major things that are on our agenda today. I'll stop there and I'll turn it over to Kate to walk us through the order. Kate?
Awesome. Thank you, Jeff. Yes, good morning, everyone. So as Jeff stated, there are several components to this order. The first component of the order is that indoor dining will be for restaurants and indoor events will be limited to 1 household per table, and then outdoor in-person dining for restaurants and indoor events will be limited to no more than 2 households per table. Under the current state order, there are currently no household limits for the number of households that can be represented in a group of 10 dining or seated at an indoor event. The state order for personal social gatherings, it does limit, generally personal social gatherings to up to 10 people from 2 households. And so what this order would do is it would establish household limits, not just for personal social gatherings under the order, but also applying household limits for indoor dining and outdoor dining at restaurants and events. So to recap, indoor dining would be limited to up to 1 household per table. That could be up to 10 people seated at the table. And then outdoor dining would be up to 2 households per table. And that could be, up to 10 people at the table. The order would also serve to limit the total number of attendees at indoor events to 25 people. Under the current state order, indoor events, which are governed by Appendix I, they can have up to 50 people per room, and it's up to 50 people based on the 25% of the posted occupancy limit of the room, or determining the amount of usable space using the state's distancing space calculator. So assuming there is enough space based on posted occupancy limit and use of the calculator, under the current state order, an indoor event could have up to 50 people per room, and they could also have what they refer to as separate designated activities, meaning that if each separate designated activity were to be 50 feet apart, have separate entrances and exits, etc. I think there are a couple of other requirements for separate facilities such as bathrooms. Then they could have, up to 50 people per separate designated activity. So under the current state order, if there was sufficient space, there were sufficient entrances, exits, bathrooms, you could have, multiples of 50 people per room for a single indoor event. What this public health order would do is just limit the total number of attendees for the indoor event to 25 people. And we do include language that, explicitly calls out that you cannot use more than 1 room, you cannot use more than 1 designated activity to increase the capacity of total attendees beyond the 25-person limit. Third component of the order is it would prohibit spectators at sporting events for adult and high school level sports. And that would also include professional sports such as NCAA sports, thinking NCAA sports at the University of Colorado. Finally, the order will include a work from home recommendation, including language that public health strongly encourages all employers in Boulder County of both critical and non-critical workplaces to identify all individuals who can work from home, either part-time or full-time, and immediately encourage such individuals to work from home to the greatest extent possible. The current state order includes various language, touching upon this issue, encouraging employers to have employees work from home wherever possible. But this public health order would strengthen that language and really try to hit the point home. Does anybody have any questions about the order?
So Kate, this is Greg. So just reading 1A. So the indoor limit for 25 for an event is not necessary. It still looks like the restaurants could operate up to 50 people at, assuming they didn't exceed the 25% capacity. That's correct, right?
That is correct. So this 25-person limitation only applies to indoor events that are governed by Appendix I. Restaurants are governed by Appendix H, and then there are other settings such as houses of worship that are not governed by Appendix I that would not have this limit either. So it's only for those events that are seeking to have more than 10 people, above that, generic 10-person gathering limit pursuant to the requirements of Appendix I.
So what is the limit on faith communities right now?
The limit on faith communities would remain the same as it is under the current public health order, and that is up to 50 people per room, assuming enough space based on 25% of the posted occupancy limit and use of the distancing space calculator. So assuming enough space, houses of worship could have up to 50 people per room. And that is similarly the case for restaurants. Under level orange of the current state order, they can have up to 50 people per room, assuming enough space based on 25% of the posted occupancy limit. Yep, and it does not look like there is a space distancing calculator requirement for restaurants.
And then on item 3, no spectators, and that it doesn't matter if it's indoors or outdoors.
Exactly. Yep, and that is for high school level and adult sports. So spectators would still be allowed for youth sports below the high school level.
This is Brooke. Around the youth sports, since we're seeing the increasing cases outside of school with school-age kids, is there any concern that this won't have as much of an effect if we're still allowing spectators at youth sports? Is there any, or are we going to more strictly enforce, say, social distancing there?
Sorry, I was having trouble getting to my mute button. This is Jeff, and the issue with youth sports is having kids who are unattended by a parent. So that's why that has stayed in there, and that is consistent with our surrounding jurisdictions. I believe Kate could validate that for me.
Yes, I would need to double check that, but I can look into that right now.
Okay, that makes sense. Thank you.
I mean, I don't have any other questions about from a legal standpoint. If anybody else does, thank you, Kate, for.
Yep. And I will confirm that Jeff is correct. That is consistent with the other jurisdictions, allowing spectators for youth sports. And so,
Oh, yeah.
Oh, yep. So just looking at the chat, we have a question from Nadine. Are we defining ages for youth sports? The current language of the order just uses the phrase adult and high school level sports. So it does not include specific ages. Rather, it just touches upon the age range based on if it's high school level or adult, being 18 or over. And the intent with that is to capture sports that are fall under CHASA's guidance, as well as adult and professional sports.
And prior to this, Kate, we had exempted, right, CU athletic practices and all of that. Is that still? Are they still exempted from all of this?
So they are still allowed to conduct their sporting activities. They're just not allowed to have spectators. So they're still allowed to perform all their sporting activities. They're just not allowed to have spectators at them. And this order would prohibit spectators, yes, both at practices as well as games.
Just for board members' knowledge as well, we've talked with both school districts as well as CU, and they're in support of this.
So, I mean, I guess my questions for you, Jeff, I mean, I assume these are all sort of data informed. This is the best we can do short of a stay-at-home order based on data of where we know transmission is happening. I mean, I think that's right. The question that we have to answer to the greater community is this the most effective steps? Are these the most effective steps we can take short of a stay-at-home order? And do we have data that supports, like, we think that, like one of my questions is around indoor versus outdoor dining. Outdoor dining doesn't seem to be a place that transmission is happening. But do we not know that because of widespread transmission? And so does it make sense to include them in new restrictions?
So there's still a 10-person, Kate, just make sure I'm on track with this. There's still a 10-person limit for outdoor dining, but it's 2 households versus 1 indoor, because we know that we have more spread indoors than outdoors. So that's an example of where we've made an adjustment based on that.
Yep. So the total number of people at each table remains the same. That's 10. The total number of people that can be indoors or outdoors, that remains the same. Like I said, up to 50 people indoors per room, assuming enough space. And outdoors, there is actually no total capacity limit, so long as there's enough space to have each table at least 6 feet apart. What this order is doing is adding household limitations to each of those settings. 1 household indoors per table, 2 households outdoors per table.
Thank you.
And as somebody who does enforcement, I mean, you know, that's always the conundrum, right? I think this is probably more on the honor system, right? Don't go out, don't plan to meet your friends from another household at the restaurant. I mean, the restaurant might do a little bit of Q&A, but they're probably not. And there's really not enough resources out there to actually have enforcers look at this, right?
That is correct, Greg.
Yeah.
And I know that, you know, we, public health has been in contact with the chambers and trying to just get a discussion with businesses as these go forward, because I know it's such a tough time for businesses. And are they aware of this coming change?
The chamber is aware of it. I did share it with John on Monday. We have not done any kind of communication in broad to businesses because we need approval from the board. We did make this effective on Saturday at 12:01 a.m. so that we have all of today, all of tomorrow to be able to make sure that we're effectively communicating it and that people are aware of it.
Along those lines, this is Brooke again. Can I ask how you all plan to communicate the new order? I ask because over the last few days, I've heard from several people who say that they just didn't know what the current regulations were. And I've also heard some people complain that it's not front page and clear in the daily camera. So we'll
John,
have a communication plan for this one since we're going to straight.
So what we do for every public health order is we send a press release, we put it on social media, we send to every municipality's public information officer and also other organizations like CU. I do share with the media. Unfortunately, I don't have control over whether it's front page or not. So I'm not sure what else we could possibly do, unless you have ideas.
No, I completely agree. I think you all have done an excellent job with communicating. It's just that I keep hearing that people aren't seeing it, and I'm not sure what to do about that. Or if it's just being, you know, I don't know. Yeah, because I think you all are doing a great job with the communication part.
Every new order is in the paper. It just might not be front page.
I mean, I mean, I will echo just how much I am impressed by how much communication, not only with the public that I see, but I know you are getting flooded with emails from people emailing you directly, and you are having to respond to those. So thank you for all of that. I think, you know, I don't know what else we could be doing from a sort of communication channel. I was thinking about like all the organizing that went on around the election in this community. Like, is there some way that we could tap into some of that community organizing muscle to just help get the message out about, you know, masking and the orders? And you know, just thinking about how do we get the message into households, particularly because even if there's a dwindling number of us who are reading the paper every day, right? So how are some other ways that we could use social networks to get messaging out?
And so how that happens is through our public information officers in our municipalities who have networks into communities. For example, in Longmont, they will take the Spanish and they will get it into their Spanish community. So it's really up to the municipalities to get it into the hands of people in their community. And they've told me they're doing that.
The other thing I'll mention too is I think you're all aware of this as board members, but I want to talk a little bit more about our business team. So our business team does chamber events, not just with the Boulder Chamber, but with all the chambers across the county. In addition to that, when we get complaints around businesses that might not be following the orders, our business team follows up with those individual businesses to educate them, make sure they're aware of the orders, make sure they know, to help them with marketing materials that can inform their constituents that come in the businesses. So we've built a pretty robust structure for trying to do as best as we can to make sure that everyone is aware and we're taking an education approach.
I will also add that there is going to be a webinar for businesses tomorrow so that they can bring their questions about the new order and we can provide them some information tomorrow before it goes into effect on Saturday.
This is Brooke again. Are surrounding counties considering similar proposals, or is Boulder alone on this resolution?
No, we do have surrounding counties doing, and maybe Kate, make sure I'm on track here, but we are working as a region. So the Metro Denver Partnership for Health has been talking regionally amongst ourselves as well as with the state and the governor's office. So Jeffco, we have one of the parts of the order, or maybe two. I don't know if, I think Jeffco's prohibiting sports, spectators, and indoor events. Is that correct, Kate?
Yes, Denver, Jefferson County, and Adams County have all taken the same approach, and I believe they might have even taken some other approaches as well. But these approaches are aligned with Denver, Jefferson County, Adams, and I believe Broomfield as well.
Thank you.
Any other discussion, questions from the board? So then, Jeff, I assume we will need a motion to approve this public health order?
Yes.
Motion to approve.
This is
Landry. Okay.
Oh, and similarly to prior orders, I apologize. I would request a motion to allow Jeff to modify the order as needed and also extend if that's the preference of the board.
Thank you, Kate.
This is Morgan. I mean, the last thing I'll just add, and I know, Jeff, I've seen your quotes. I think that we're really driving home the message that these are not like what we want to be doing as a community, right? We don't want to be increasing restrictions, and we certainly don't want to be hurting our businesses, more than they're already hurting right now. And again, I'm just echoing things that I know I have read you are saying in these press releases, but just that this really is, it feels like the businesses are a little bit being hurt by individual behavior, like that we're not able to change our behavior as a community, and therefore we're hurting these business owners, and that just doesn't feel good to anyone, right? So how can we continue to try to get that message through, like, hey, if you want to support local business, then you got to change your behavior.
Yep. I think, Morgan, and that's the $1 million question, and it's not just us, right? It's the state, it's the nation right now. This is not a trend that's unique to Boulder County. One of the things I can tell you, and I was going to talk about this a little bit more in the letter, but since the question came here, hey guys, sorry, my dogs, this is their playtime, is that the chamber is coming to our agency representatives meeting today, which is just all of the municipalities, city managers, town managers, to talk about the impacts that they're seeing in businesses which I have already seen, and I know how significant they are. Our businesses don't have CARES funding that's going to continue into this stage, and that is part of the challenge. So we are, by making this decision, it is really difficult for our businesses, and this is painful. I have not just put it in quotes in the paper, but I've been talking about this at every single presentation that I'm doing, everywhere I'm doing it. And it does come down to individual behavior. Obviously, as Kate can illustrate really clearly, we're not going to be going into people's individual houses to do enforcement. People have to take personal responsibility. And we're in a place where, again, that map shows you that we have a lot of red, and our incidence is increasing across the state. Our hospitalizations are increasing across the state. So the conversation with the chamber today and the agency representatives is to talk about a marketing campaign and the impacts on businesses, and to see if we can find a different way to be able to impact individual behaviors, because the messaging right now obviously is not working because people aren't taking the responsibility. And I shouldn't say that as wholeheartedly, because that's not true. We do have a lot of people, and we certainly have businesses and schools absolutely taking responsibility for the most part to make sure that they're doing everything they can to reduce the spread. But we all have to be in this together. And if we're not all in this together, what I've been saying to folks that you've heard me say here is that we're going to continue to see this trend increase. I've also brought in chambers from the Metro directors. So I asked, we had a conversation last night, and chamber representatives from each of the other counties are also going to participate in the meeting today because they're facing the same challenges. I don't know if we'll be able to do something as a region with chambers or not, but they're going to be on the call today.
And with respect to restaurants, we are thinking that hopefully this won't have too much of a detrimental economic impact on restaurants by limiting to 1 household indoors, 2 household outdoors, without limiting any capacity, especially outdoors. Restaurants, so long as they're working with their local municipality to increase outdoor seating space as much as possible, hoping to maximize what good weather we do have in order to allow restaurants to seat as many people outdoors as possible. The state has also issued guidance that restaurants can rely on with respect to temporary structures outside so that they can further try and maximize outdoor space as the weather is turning.
Yeah, clearly we need to stem the tide. And so hopefully, hopefully these changes can at least get us, flattening the curve, if not bending it, before more restrictive measures are going to be needed. So
Can I just clarify, Kate, are you saying that outdoor dining can have more than 10 people at a table?
No, outdoor dining is limited to 10 people at a table from up to 2 households, but the number of tables, the number of groups up to 10 is not limited.
Thanks.
No problem.
Greg, I think you had a motion, but I didn't hear a second.
I would ask that we repeat the motion and also include in addition to approving the public health order, allowing the executive director the flexibility to amend the health order. So if somebody wants to make that, great.
I move that we approve the Public Health Order 2020-10, limiting indoor event capacity to 25 persons, limiting indoor dining to 1 household, prohibiting spectators at sporting events, and strongly recommending that all businesses in Boulder County have their employees start or continue working from home to the extent possible. and also allow the amendment without board approval, the amendment or extension without board approval.
Second.
Second.
Okay, we have a motion and a second. Take a vote. All in favor?
Aye.
Anybody opposed? Okay. All right, that motion carries. Next item. You're muted, Jeff.
The last item I had was the letter, the approval of the letter to the governor. I had Tammy sent that last night, but I'm happy to pull it up on the screen here and just walk through it quickly and talk about why we think this is important to do. No, that's not it. Sorry. There it is. Bear with me for 1 second.
And with respect to the order, while Jeff is pulling it up, I would just like to clarify that this letter is informational. It's not an official board action, so we won't need a formal motion for it
Okay.
pursuant to open meetings laws.
Oh, thank you.
No problem.
So the reason we're asking the board to endorse this letter is I think you may be aware that, and I'd mentioned before, that the Metro directors have been working really closely together, and we've been working in conjunction with the state. We have made a formal request through the Metro Denver Partnership for Health, as well as CalFO, to the governor's office, that the governor take action and act on the dial which has been put in place, and to use the categorizations of the dial to help us control the disease. And we know that, like I had said before, that an individual county actions, some counties have support for actions, many counties do not. And if we don't have action from the chief executive at the state, when I showed you that map and you can see how much red is on it, we're not going to be effective at being able to control the spread of this disease. We're going to get into worsening hospitalizations and issues with hospitals, running into surge capacity, which then we know results in greater numbers of death when people can't be effectively treated at hospitals. We don't know exactly how long that's going to be. There is some projections that are being looked at now with the Colorado School of Public Health, the governor's office, and the state, that I believe will be released publicly at the end of the day Friday or on the weekend. And we will have a better idea at that point of when exactly that may happen. But we need state action to occur in order to effectively control this disease spread right now. The last thing we want to do is be in a similar situation where North Dakota is, where we've lost complete control of the spread. We have significant hospitalizations. We're in alternative standards of care, which would be a worst case scenario. And we've had to then go into all of our alternative care site facility activations. As I think you all know, we're already above the hospitalization numbers that we saw anytime previously in this disease outbreak. So we're already heading into a place that is really difficult. As Morgan noted, we know that our businesses, for the majority, are doing everything they can to try to control the spread of this disease because they want to remain open. They want to remain viable. And we also know that we are having deaths. As I mentioned at the board meeting, in the last month, we've seen multiple deaths, which we hadn't seen across the summer. We know we're having impacts. We know our hospitals in Boulder County are having staffing issues right now. They are not yet telling us that they are exceeding capacity in other areas, but staffing issues are a big concern. And we know that's likely going to get worse. So we really do need the governor's office to act at a state or at least a metro-wide level, and that's what we have encouraged the governor to do from, again, the Metro Denver Partnership for Health, CALFO, and I am asking the board to send a similar letter to urge the governor to do that. I'll stop there.
Jeff, this is Trina, Boulder County Public Health Attorney. Just another component of this letter is pointing out the interconnectedness of the metro area public health agencies. And there was some traffic data that came out indicating that we're nearing pre-pandemic levels in terms of people commuting and moving around. And so that's another reason for that we're requesting the statewide action, because that doesn't, if we do something locally, that doesn't stop people from coming in and going out to other jurisdictions.
And what's the Jeff, are the Metro public health directors talking about if there is inaction from the governor's office considering doing something as like a metro-wide? I guess I have my doubts that Governor Polis is going to act on it, only because he seems to be hesitant to do things that are sort of forcing. So I'm just wondering if there's like a backup plan if the governor doesn't act.
Yeah, we absolutely are. I haven't showed the graph today of the metro cases, but I think, and Greg probably knows this number exactly, I think Denver's around 550 cases per day. That was where the state was during the summertime. And so the increases in cases across the metro, and when you look at counties that have been above 1,000 for multiple weeks now on that map, in terms of case rates, the challenge is that we have to get control of this. So for sure, we have been talking about, and talking specifically with CDPHE, that if we can't get a control on the number of increasing cases, what is our backup plan? And we fully, and I've been saying this to the public, because if people don't change individual behaviors, if these orders don't turn us around, if moving to level orange doesn't start to turn this around, and we would expect to see impacts in the next week associated with our change to orange level, and in the week following that associated with these orders, to determine how much impact we're making. But if that's not working, we can't just let our hospitals move into critical alternative standards of care. So we are talking about a regional action together, and we are looking at that as a backup plan.
This is Brooke. Can we clarify by requesting stay at home? So we would be requesting to go back to where we were in March. So that would be closing a lot of restaurants, gyms, places of worship, things like that, correct?
Yeah.
Under the current state order, they have released an updated stay-at-home framework. There are some notable changes to that framework. For example, with respect to restaurants, under the current stay-at-home framework, they would be able to continue providing outdoor in-person dining services. So that is one notable change with respect to restaurants. Under the prior stay-at-home order, they were only allowed to do, curbside or delivery, whereas now they would be allowed to continue in-person dining outdoors. With respect to houses of worship, the current stay-at-home framework absolutely encourages them to provide services remotely through online platforms or in outdoor settings, but they are able to provide in-person services for groups of 10 or fewer per room. Oh, another notable change is that under the prior stay-at-home framework, non-critical retail was entirely closed, whereas now non-critical retail would be able to continue operating via curbside only. And gyms would be allowed to provide services for individuals outdoors in groups up to 10. So there are some changes that do take into account the economic impact on businesses and allow them to perform more operations than they were back in March. And similar to
thank
back,
you.
yep, and similar to back in March, businesses can continue to perform their minimum operations in order to maintain their inventory.
Okay, thank you. Yeah, because just to echo what everybody else said, we don't really want, we just saw that Q3 there was some recovery. It's very unfortunate to have to crush some of the businesses again, or just take away some of their advances again. It's a tough situation.
It is extremely tough situation. One of the things that I'll say is that we'll be reaching out to our representatives. I believe this is true, that when we did the stay-at-home order back in, I think it was late March, early April, that we didn't have federal funding in hand at that point. It came after that. And my hope is that with the change in leadership that we will see more opportunities for some federal funding as well to come forward in 2021. We of course don't know that for sure, but that will be a push. And the way that states are heading across the entire nation, we're in a serious place. Highest numbers of the entire pandemic, hospitalizations again increasing to places where they haven't been pre-pandemic. I'm sorry, in the earlier portion of the pandemic. And so we're in a very tough place again across the entire nation.
Yeah, agreed. And, I think we've talked about it at other board meetings and emergency meetings, the mental health impact on individuals. So where we're at a place where we're already seeing a lot of drain on people and their refusal to stick with even some of the minimal requirements. If we now go to a stay at home, I think it's going to be mentally pretty challenging for a lot of people. But it's a trade-off, I guess, the mental health for the rising hospitalization rates.
Jeff, I'm curious, with so many states in excess of the 350 per 100,000 in terms of new cases, we know the healthcare system is really, they're not in red flag status yet, but we know things are trending that way. And, so what have conversations with the state? Assuming that this continues, let's say it follows the trajectory that the School of Public Health's latest forecast shows, where we hit ICU capacity in late December and continue that through end of January. Are they waiting? Do they have like a trigger number in mind for a revised stay-at-home order statewide?
So we had John Samet on the phone with us last night for an hour, and we asked him for that data. So I'll give you the specific thing that we asked him for was, based on the Metro look at cases right now, what does that really mean in terms of when we would trigger that, both from, we asked him to also try to factor in staffing, because we know that staffing right now for our hospitals has been one of the biggest challenges, more so than med bed availability or ICU availability. And they haven't, as you know, I think you all know, that they haven't yet changed their elective surgery procedures because they still believe that they can create some capacity, but the staffing is a big issue. So we've asked John to do specific projections about what level of case rise we're seeing right now and how long we think that's going to take in order to have our hospitals in a place where we're thinking about alternative standards of care. So that modeling is being thought about now. He's going to come back to us, probably not by Friday. The modeling they've been running for the governor by Friday doesn't include all that, but he knows that we are looking at an alternate plan, and he's going to try to help us predict what that might look like. So this Colorado School of Public Health is working really closely with us.
And then, but that doesn't, I'm sure under the worst case scenarios, the state has had to have kicked around the idea of even if we hit those critical thresholds, is there still an appetite for stay at home?
So what I saw in the article from the governor's office. There was a CPR article where they were talking about the Metro Denver Partnership for Health and the CalFO letter that was sent to the governor. The governor's staff responded to that in the CPR article and said, if we were moving towards alternative standards of care, I don't remember if that was the exact language, but if our hospitals were at surge capacity, they weren't able to care for people, then the governor would act. That's in general the kind of language that was in there. What we've heard from the state is that it's not likely that the governor would act until we get to that point.
Okay, so if anything, this letter is, I mean, outside of just being a strong recommendation, I mean, they're probably going to wait until they hit those triggers. And, you know, and at this time, they would, you know, I could see if I was the governor and I received this letter and I'd be like, well, wait a second, you're not going to a stay-at-home order. If the situation's that dire in Boulder County, and, you know, because obviously, like you said, right, we are interconnected. So Boulder having a stay-at-home order doesn't necessarily work based on the other mobility factors. And so it needs to be a coordinated approach, which absolutely makes sense. So
absolutely, and the governor's office knows this, Greg. So just so you're all of your minds are put to rest, we have communicated probably 10 times in the last 2 weeks that it's interconnected, that we know that individual counties going is not going to solve the solution, is not going to solve the problem. So both the state health department as well as the governor's office has heard this feedback from us multiple times. I will share the CPR article with you all so that you can see what was addressed in that article and how the governor's office responded to it. But they've heard this multiple times. This is not going to be a surprise to them.
well, and we know, you know, I mean, I'm glad I wasn't aware of the revisions for outdoor dining under a stay-at-home. I guess my only other question would be, does stay-at-home with the, you know, onset of out ski season mainly, right? But other outdoor activities, so whether that's going to parks, whether that's, you know, going to golf courses if they're open, I mean, things that you can do outside to relieve the cabin fever. I mean, are any of those at risk under a statewide stay-at-home?
Stay-at-home does not close ski resorts.
Okay. I just think it's those, you know, it's those outlets for cabin fever, you know, and maybe if we're lucky, we'll have a warmer than normal winter. But the fact is, yeah, I don't see any indicator that says we shouldn't be preparing for a revised stay-at-home order.
Do you want to add that what you just said? Do you want us to add that piece to the letter that we encourage even under a stay-at-home, we encourage outdoor activities to be able to continue where the risk is, I think the governor said 19 times or 20 times lower outside?
Yeah. Well, and to point out, especially, you know, that the work that the state has done to, you know, for if they do go to stay at home again, at least it doesn't close down restaurants, right? And in theory, if they have the ability to have outdoor dining, but certainly they can still provide takeout and delivery as well. So yeah, I think that's important because I think that's just part of the fatigue is the cabin fever and more working from home, all the other elements that come with stay at home. And, you know, the reality is I think the school districts are even recognizing that this is not sustainable. And so many of them have just said, no, guess what? We're either not going back to hybrid or we're, you know, right now it's through January, but I think we all know it's going to be longer than that. So I don't see anything that doesn't make us believe that eventually we're going to be in this place. And it'll probably be the healthcare system that will necessitate that. But at the same time, I think it's just important to point out that there will be differences with a new stay-at-home versus, you know, what was in place before.
Yeah, and I
So
agree. I think preserving some of those outlets for maintaining mental health, the outdoor activities, that's important. And it also sounds like the trigger for stay at home is pretty late in the state's thinking. If it's going to be at the point where you're almost at capacity and already evaluating alternative standards of care, that seems like a loss then. So yeah, I think, you know, asking for it to be put in place sooner with an earlier trigger is valid.
All right, I'm not hearing any board members say they don't agree with adding that statement. So if we're good, and there's no more questions. Kate, you said we don't need approval on the letter.
Correct, we don't need a formal motion.
yeah, so if we can just squeeze in a paragraph, short paragraph, Jeff, on the importance of outdoor activities and mental health during stay at home, I would be really happy with that.
Is it okay if I have you review it after I put it in?
Absolutely.
Great, thank you.
Okay. Anything else?
That's it.
Okay. So this emergency meeting of the Boulder County Board of Health is adjourned at 8:53 a.m. Thank you, everybody.
Thank you, Jeff. Thank you, everyone.
Thanks.
Thank you. Thanks again for your flexibility. I appreciate it very much.